All right, everyone, we're going to go ahead and get started. Welcome to today's webinar, How to Improve Your HIPAA Compliance Efforts in 2018. My name is Andrew, and I work in marketing here at Security Metrics. And our presenter today is Barney, who is the Senior HIPAA Analyst here at Security Metrics. And he's on his decade now here at the company. He has a lot of experience. He travels all over the world at different speaking engagements and also working with small all the way up to large healthcare organizations, really helping them understand the requirements of HIPAA compliance and what they can do to improve their overall security posture. So we're really excited to have him presenting today, and he's going to have a lot of good information for us. Just a couple of housekeeping items before we get started. We are recording this presentation today, so at the conclusion of this webinar, we'll go ahead and get that recording put together, and we will send that out to the email that you used to register for today's webinar. So if you'd like to review the slides, if you'd like to send it out to someone else in your organization, you're more than welcome to do that. Also, another thing I wanted to bring up, at the conclusion of the webinar, we will have a Q&A session. So if you have any questions that arise during the webinar, feel free to chat those in using your GoToWebinar control panel, and we will answer as many of those as we can at the conclusion of the webinar. If there's a question that we don't get to in the webinar, we will reach out to you in the next few days on an individual basis to make sure you get the answers that you need. So just a little bit about Security Metrics. So we have been in the data security business for over 18 years now, helping organizations comply with mandates, avoid security breaches, and recover from data theft. So we've got a lot of experience, particularly in the HIPAA sphere, and we're hoping to give you some good information today. And as I mentioned, we will be sending out a recording of the presentation today for your review. Just a little bit about today's agenda. So we will be covering the current healthcare breach trends, and then Brand will give us 5 tips to improve HIPAA compliance in 2018, as well as how to create a security culture at your organization. And also, for those of you that are interested, at the conclusion of the webinar and after the Q&A session, you're welcome to stay on for an additional 5 minutes or so, and we'll be actually giving you a demo of our new Security Metrics PI scan tool, which is actually a tool that will scan for personally identifiable information on your systems. So you're welcome to stay on for a quick demo of that at the conclusion of the webinar. And if you're storing sensitive data, patient information, anything like that, this is a tool that can really benefit your organization.
All right, guys. Thank you so much for, ladies and gentlemen, for taking the time today out of your busy schedules to come and discuss HIPAA compliance and what you can be doing to secure your organization. As Andrew mentioned, my name's Barney. I am the Senior HIPAA Assessor here at Security Metrics. I've been here about 10 years now. And I'm also one of our PCI QSAs as well, so a PCI Assessor. Now, as exciting as PCI would be to talk about, that's not why we're here today. We're here to talk about HIPAA compliance and some of the things we can do. So I do want to go through this. There's a lot of information to cover. As we mentioned, the presentation will be available after, but I do encourage you to ask any questions that you have and certainly to take notes, because this is all very, very important. So let's first talk about some of the current healthcare breach trends, or some of the healthcare trends that we see. Now, as I get an opportunity to travel all over the world, working with entities of all different types, whether they be a business associate, a hybrid, a covered entity, those located in foreign countries, especially outside of the United States, we do get to talk about and see all kinds of different environments. One of the things that we're seeing, or that I see quite frequently, is that organizations, and as we look at the breach trends, organizations are not keeping up with the vulnerabilities. Many people are being breached today, so the breaches have increased in their frequency, and I anticipate when I have this same conversation next year, in 2020 and 2021, that it'll have a an almost exponential type feel to it. Attackers are wisening up to the lack of security, the lack of compliance in the healthcare space, and they are utilizing that to attack the healthcare organizations and really take their data or hurt their systems in some way. It's an interesting statistic is that the FBI reports an increased attacks against the healthcare organizations, with 88% of ransomware attacks were against healthcare in the United States of America. Now, I'm sure everybody's heard about ransomware, somebody getting their data encrypted and holding them ransom for it. And hey, if you just sign up and make sure you pay us in 300 Bitcoin, we'll give you your data back. It was really interesting for me to hear that was against so many people were having that attack on them in the healthcare industry. Now, as we look forward to this, we want to make sure that we talk about how those breaches happen, and I'll talk about that in a few slides. Now, as we look at HIPAA requirements as a whole, Security Metrics had interviewed over 50 healthcare professionals. Now, these people were responsible for HIPAA compliance, whether they be a privacy official or a security official, about their patient data and data security. Now, the responses were from organizations that are primarily 0 to 500 employees. So it could be a small mom and pop organization up to a larger firm that's working with patients, whether that be a covered entity or a business associate. One of the things that I want to stress is no matter which entity type you are, if you are dealing with protected health information, attackers want your data. But from that survey, back to the survey, 78% of those healthcare professionals that had answered this survey stated that they were encrypting their patient data. This one really surprised me. Oftentimes, when I'm in an organization, I find that entities have not properly encrypted their data. Two types that really should be considered, both data at rest and data in transit. So if you are saying to yourself, well, we encrypt data, or our EHR encrypts data, or my IT guys are encrypting my data, the question is, are you encrypting all of your data? That which is at rest in your database, that which is at rest in possibly flat files, spreadsheets, etc., and data that's being transmitted. Both internal connections and external need to be encrypted as well. Now, interestingly, 26% of those that were interviewed had said that they were using some form of multi-factor authentication for remote access. I would have said this was almost dead on with industry statistics. If you've participated in PCI, you recognize that PCI requirements require you to have some form of administrative two-factor authentication or multi-factor authentication. Attackers are definitely targeting your logins. If they can get into your systems, why not? So this is a big statistic and is accurate. We start to see that 34% of organizations, and this one surprised me, 34% of organizations stated that they had tested or trained and tested their employees on HIPAA. I would have thought initially that would have been a screaming 100%. Now, trained well, if anybody had said they had trained their staff well enough, I would have disagreed. Realistically, we are putting some effort into training our employees, but when it comes to training them well enough to do their job and to protect your data, unfortunately, that just isn't happening. So some very interesting statistics. Now, as we start to look at the top organizational vulnerabilities, what's surprising here for many organizations is that a lot of these really aren't overly technical. People would have said, it was the new Heartbleed attack or Suite 32 that we were losing data in, something that made the news, made the headlines. These are really quite basic. And interestingly enough, they're the same ones, the same organizational vulnerabilities as we saw last year. So again, that's not changing. First, and in no particular order here, is going to be insecure remote access. If you're not securing your remote access into your environment, to your in-scope environment, whether that be in the cloud, whether that be your servers, your firewalls, the administrative access. We're not just thinking of patients using a portal, which that can be obtuse and quite burdensome if you're going to force that on them. Then if you decide to, then that's organizationally, I would understand that. But what I'm really concerned about is those administrative users who are making a remote connection to the environment. So they have to have some type of two-factor authentication. We're changing two-factor authentication to the verbiage of multi-factor authentication now, but something something you have, or something you are. Employees, the human element, this is a big one, and I see a lot of people losing data because they haven't trained their staff. I don't think that employees are going in and losing data intentionally. I certainly don't believe that. It does happen occasionally, but employees really are trying their hardest to do the best they can. But if they're not trained, we're going to see the employees, or the human element can always be a vulnerability that will cause a data loss. The BYOD procedures, so this is bring your own device. This is employees that are, and we oftentimes think of it as like a privately owned laptop or cell phone that's being brought in and used on the company network. But while that is accurate and that is true, it's not just that. We need to also consider the devices that are being used at our company. So whether it be a work laptop or work phone that's connected to our sensitive data environment, that then goes home with that employee, or goes to the airport with that employee as they make connections to other people's networks, and then bring those devices back to our sensitive data environment. And lastly, third parties. Now, I know some of you guys out there that are on the call today that are listening are third parties to a covered entity. So you're engaging as a business associate, you're performing some duty, whether that be development or your platform as a service, infrastructure as a service, your billing or something like that. We're seeing a lot of vulnerabilities that are coming through third parties that are introducing new risk, and this will again continue to be one. I think next year this list won't look any different. It really won't. Now, as we look at some of the data security updates, this is a little different than the healthcare industry. The healthcare industry really hasn't changed much this year. The industry may have changed, but when we look at HIPAA, that's not going to change a whole lot, and I don't anticipate that that'll change anytime soon. We did see some password clarifications that were released from NIST, and they had published those. So now we're talking about passphrases. We're talking about clarification as to what is considered strong passwords or passphrases. We also see almost 10 months ago, about a year ago, I guess you could say, the OWASP, which is the Open Web Application Security Project. The top 10 had been re-released. Now, some of those items that were in the OWASP, they remain the same thing. So as we look at things like broken access control or injection-related attacks for your developers out there, for those that are using some type of developer, it's important to keep in mind that has been re-released, but that data really didn't change much either. Because again, keeping in mind the attackers, they are using some new methods, but most of it can stay the same because we haven't updated our processes. We haven't matured or secured ourselves in such a way that would constitute any new major change there. So what I've seen a lot this year in my travels is an issue with compliance mentality. So a lot of people that I deal with are excited or have an organizational mandate to get compliant. But oftentimes what I'm seeing is the entity that is really checklisting or check boxing is what I would call it, their compliance efforts. So they're going down a list of requirements saying, are we in compliance this, yes or no, or not applicable even, not in place kind of stuff. That type of thing is acceptable for a portion of your compliance, for a portion of your security. I don't think we can get away from that. But only being a checklist or a checkbox organization is what will lead us to a data breach, what will lead us to unauthorized uses and disclosures. It's really easy to think of a lot of attackers, as these big state-sponsored guys, but that's not always the case. A lot of these people can be that could lead to a breach of data. Could be your employees, as I mentioned earlier, and it could also be the patient that's potentially sitting in your offices or sitting in your hospital that decides, hey, I'd like to play some video games on the wireless, and then says, oh my gosh, I can see far more than I should have, or I'm able to access this application that's not encrypted. They're not using HTTPS for their login credentials, etc. So it is going to continue to be a problem. Some of the dangers, and I won't spend too long here, but some of the dangers of that negligence leads to, again, unauthorized use and disclosure of protected health information. And I think we focus a lot on that. We're all worried about that. As HHS, OCR has breach notification, guidelines and rules that they require for us to say, hey, if we've lost that patient's data or it's been inappropriately disclosed or used, that is a big problem, and it'll, unfortunately, as I mentioned before, and I'll say again and again and again, it's going to continue to happen until we make a big shift into real security, not just trying to check boxes. But one of the things that I find really interesting is the patient harm. So it's not just necessarily a loss of data, but to lose somebody's, maybe mental health records, to lose, somebody's records as it pertains to drug use or, any other type of history that patient has. That can be a real harm to them. We also look at networked medical devices. I love to talk about this, and frankly, could spend an entire hour talking about that alone. But a networked medical device, so something that could potentially be changed, or the integrity of that device could be dampened or harmed, and lead to an actual physical harm of that patient. We don't really talk about that a lot in HIPAA, and a lot of people aren't really talking about it, but we do see it. And as we make this leap into our healthcare space being more technical, more advanced, we will see attacks that can not just lead to uses and disclosures of protected health information, a loss of that data, but also to patient harm, whether it be physical or emotional. Now, when I talk to industry professionals everywhere, whether you be a covered entity of any size or a business associate, I really find that most people didn't go into this profession to make money. Now, certainly I know some providers out there who are doing quite well for themselves, and nobody faults them for that. But I think a lot of us get into the healthcare space to help patients, to make a difference in our communities, to largely impact a patient's life in such a way that it is a positive experience for them in their own lives. But we need to recognize that motivation as we consider security and as we consider our compliance. Because if we begin to ruin that experience or to have attrition, it will lead to a financial loss, absolutely, but it can also harm our patients. Now, let's talk about the exciting stuff, the reason you're here. What can you do? What can your organization be doing to improve your compliance posture and position this year in 2018? Now, I think it's unfortunate that we're having this conversation almost halfway through the year. So, you're a little bit behind if you're in it, but hopefully you're doing some of these things. And if you're not, we're gonna talk about how you can do it. Now, first thing that you need to do to make sure that your position and that your compliance and security is improved is to focus on your policies and procedures. Now, I know what you're thinking, Brand, I've done this. This is one thing that I do well, or one thing that we have. What we oftentimes are seeing, that I see, is that people have done some portion of the policies and procedures, whether that be, and it's usually privacy that they've focused on, but their policies and procedures are just a few pages if they're used at all, if they have anything for their staff. Now, not all policies and procedures are going to apply to every one of your staff members, but certainly a policy and procedure should never just be 2 to 3 pages. And you really need to make sure that your policies and procedures, and I see this a lot as well, aren't just paperweights that need to be condensed. A very large stack of papers. It's not uncommon for me to go to an organization and for them I say, hey, let me see your policies and procedures, to which they dump, the equivalent of, my entire education on the table. I mean, you really dump a lot of papers on me. And when I ask, tell me what's in there. Show me where to find your policies and procedures for your firewalls or encryption or uses and disclosures. They don't know because they're not usable. So policies and procedures, getting these done this year will be really important for you. Not just to mention, this is what HHS and OCR is going to request to see if you have an investigation, whether that be through a complaint or through a breach. They're going to reach out to you and say, send me your policies and procedures. It'll be one of the first questions they ask. And you need to be prepared for that. If your policies and procedures aren't sufficient or are not currently in place, you don't know how to use them or you don't know where something's located, it can or it may lead to further investigation into your organization, which certainly may be warranted, but the idea being that we want to avoid that if we can. So we need to make sure that we first implement those policies and procedures. You need to find out what policies and procedures you currently have and what policies and procedures you need as you move forward. Do you maybe use a cloud vendor to store some of your data or transmit data? What do you have policies and procedures for that? Do you have policies and procedures again for your firewall or your encryption, data at rest, data in transit, business continuity, business contingency? Are your staff trained on the policies and procedures that you have? Those policies and procedures that apply to them. If they're not, it's time to start training them. Training will be important. Now, making sure that those policies and procedures, it's not uncommon for me to go into an organization and say, show me, with whatever it may be, show me where that policy is. And the staff member says, I don't know where it was. I read them when I started my employment. I signed a document stating that I understood them. I don't know. They're on a share somewhere. But if they were to try and find it, usually it's quite painful for both them and myself to try to find. And then lastly, make sure that you're regularly updating your policies and procedures. As your organization changes, your roadmap, that policy and procedure, should adapt and change with it. Now, here's a couple examples, and I've given a few of these as we've talked, but the privacy rule policies, this certainly is not all of them. We do 20 or 30 slides with just all the policies and procedures. I recognize that's painful, guys. But a couple examples might be the uses and disclosures of PHI. You probably already have that. Your notices of privacy practices, so your NPPs. Those will be just a few examples, but remembering you need to have that. Now, if you're a business associate that's listening, you need to make sure that you look through your BAA, so your business associate agreement, in determining what, if any, privacy rule policies or privacy rules apply to you, what you have been obligated to follow. Oftentimes I'll go into an organization that's a business associate and they won't realize that they have been obligated, contractually obligated, to be following a certain set of the privacy rules, and they're not currently doing it because they weren't even aware. So oftentimes these policies are pretty easy to do. You just have to get it out and do it. The security rule policies, this is an area where most people just have almost nothing. And the policies and procedures that you have for other mandates, things like your PCI, may cover some portion. If the environment is identical, they could potentially be covering you and that requirement, but you've got to pull those policies out to determine. Things like your password policies, your physical security, firewall and router configuration standards, things like the ingress and egress of traffic. And I recognize, guys, some of these things may be a little more technical in nature, and so for that I do apologize, but the security rule of HIPAA is going to be far more technical in nature. And just because it's technical and may be hard for us to understand doesn't mean we can get away with not having a policy, not having proper implementation. Number two, second thing you can be working on in 2018, make sure your incident response plan is in place. Now here's the reality. If you have not already been breached, in the future, it is very likely that you will be. Now, whether that breach be a small incidental breach, something that is not as impactful, or an extremely large breach where your database has been exfiltrated outside of your network. That can vary depending on how much time and money you've invested into actual real security. But the reality is, if you don't prepare for a breach, the liability and your responsibility is going to be up there, and it's going to be very painful. So people say all the time, Brand, what is a breach? What constitutes a breach? Well, I mean, it's really simple here. It's any unauthorized use and disclosure of PHI, so of your protected health information, or versely electronic protected health information. So if somebody accesses your networks and is viewing anything in there that could impact the security of or impact the confidentiality, integrity, availability, again, we've had a breach of our systems, we've had a breach of our data. Oftentimes people say, well, Brand, they didn't take anything, they just viewed it. Again, that's while their severity, I get that is in place, but it is still a breach. Now, when we talk about our incident response plan, people say, well, we don't do that, or we have one, but we've not tested it. Let's talk about what the purpose is for you. You need to make sure that your incident response plan outlines what you will do in the event that an incident is realized. Whether you have a rogue wireless access point, whether a laptop has been stolen, these incidents can vary. It could also be data has been taken by malware. So different types of incidents for different types of organizations. But first, you need to make sure that's documented and you coordinate your response during it. Second, you want to make sure that you minimize the impact of it and that you're able to restore operations as quickly as possible. This will help you to reduce your fines and protect your company and your customers. So getting back to business quickly. You need to make sure that you're identifying all of the potential risks, threats, and vulnerabilities that an attacker would use to attack you, and that would indicate some type of response strategy. This will be done through a risk analysis, and we'll talk about that on the next point. But ask yourself, what equipment would cause the greatest risk if lost or stolen? What process or what data would constitute the greatest loss to us? Now, as we do that, back to point number one, we need to make sure that we have policies and procedures set up that create a baseline of normal activity that'll help you to identify a breach. So if you don't have those policies and procedures set up, if you don't have a normal baseline documented, identifying a breach is going to be very challenging. Now, it is not uncommon for most people to engage a third-party service provider to help them with identifying, containing a breach, and recording information on that breach. So if you're going to engage somebody, if you say, hey, we don't have the technical acumen or the ability to identify or contain that breach, you would engage somebody else, and that needs to be documented in your policies and procedures. That needs to be documented in your incident response plan. You also want to make sure that you have in there your notification and communication plan. A lot of people are missing this one, and a lot of people are getting on the, being put on the hook for some fairly serious penalties because they didn't properly notify individuals within their organization, whether that be a third party, whether it be the covered entity, or the patient themselves. So make sure that is properly done. It's not just calling the police to say we've had a breach. And then we make sure, again, that employee training is put into there. Now, what you want to do is make sure that you set up a response team. Now, everybody's organization, I recognize we had people across the gamut here for organization size. So your organization may just be a very small 1-2-man operation for your security and privacy officials. But no matter what, you want to make sure that you organize a team and that they understand what their responsibilities are in that response team. So make sure that you have a team leader, make sure that you have a documentation and timeline leader, that if you have human resources or legal representation, that they're brought into this. What most people are doing is assuming that another group or another person is responsible to take care of these things, and then they leave them out of the incident response. They don't include them in that, and that can be extremely detrimental to you guys. Now, a part of that is making sure that executive members of your company, they buy into this plan so that they understand what you propose to do in the event that there's an incident. So, the reality is if you don't respond properly, you will be fined at a higher amount and rate. And helping your incident response team communicate that effectively to the executive team at your organization, again, whether you be a small organization or extremely large, that's going to be a critical mission point. Now, training employees, I've said this and I'll say it again, training your employees is important. Making sure that everybody understands that security applies to them. Everybody may access data, may access systems differently. So to give an example, you may have development team your development team doesn't have access to production. So they're thinking, what in the heck, what would apply to me? Well, we could go back to those OWASP top 10, making sure that they are trained on how to properly develop the application or develop systems that integrate in with your patient data. So making sure they're trained there and that they understand it does apply. You might also have a front desk office manager who he or she has very varying, I guess you might say, access to patient data. Making sure that they're aware of things like phishing attempts or social engineering will be important. And then making sure that your incident response team is properly trained. Now, last and not least for your incident response plan, once you get it set up, once you have that properly documented, you need to test it. So we can't just say, again, like all of our policies, we can't say we just have it. We need to be able to use that policy. So I recommend that you conduct a tabletop exercise at least once per year. So at least once per year. This will keep you both in your compliance, so it'll keep you adhering to compliance for HIPAA up to including PCI, but it'll also help you to find gaps in your plan, to practice each person's role, whether you have a 20-person incident response team or a 2-person incident response team. They'll understand what they need to be doing. You can then refine any communications that need to take place between departments. So the physicians need to be communicating this to IT, and IT needs to communicate to HR and legal communicates with the courts. And again, that incident response plan will be important that it's documented and tested. It'll also help you to document what you've learned. I have never seen an incident response plan test where somebody didn't learn something new about themselves or their organization. This is an awesome tool to use, so get that one going. Third, and this one's super important, HHS is really chasing this one. They want to see everybody doing this, and that's a risk analysis. If you have not performed a risk analysis, it's time to do one. Get started on it today. What can you do today to do this? So let's talk a little bit about what a risk analysis is. A risk analysis is identification of the risks, threats, and vulnerabilities to your organization, to your systems, to the assets within your systems, whether it be servers, workstations, mobile devices, printers, copiers, fax machines. I could go on and on and on about the types of data or systems that can be done, but also to the human element, environmental risks, threats, and vulnerabilities, organizational, regulatory. There's a lot of different types of risk, threats, and vulnerabilities that can be acted upon, and we need to make sure we're doing it. But if you've done one, you need to make sure that you review it and that you update your risk analysis at least on an annual basis. I recommend that you do it every time your environment changes. So if you're adding a new computer system or you have a merger or an acquisition, that would be a really awesome time to perform a risk analysis and make sure that that's done. But I'm sure I know what you're thinking, and that's, Brand, where do I start? How do I do it? The first thing you want to make sure you do is identify where your PHI and your ePHI is created, received, transmitted, and maintained or stored. If you don't understand what systems are touching data and how they interact with that data, systems or people or processes, it's going to be incredibly challenging to properly identify any potential risk, threat, or vulnerability you have. So first thing to do is to get it started by going through a scoping exercise. I recommend that you review the policies and procedures that you have that involve systems or processes that touch protected health information in some way. So make sure those are reviewed. Make sure that you interview and bring your personnel into this, so your employees. You'll find, and you may be quite surprised at the way your employees interact with data, the way they interact with systems, and the way that they have introduced new potential risks, threats, and vulnerabilities in your environment. So a scoping exercise, if you will, is a good place to start. And that I always recommend to make sure you do that at least annually. So if you haven't done a scoping exercise or you've gone through one, do it every single year. Ask those questions yearly. A lot of people that I work with will engage a third party to perform a risk analysis for them due to its technical nature. So they'll say, hey, we want somebody else to help us in the identification of those. And there's nothing wrong with that either, but it is your responsibility to perform one. Now, you'll be asking questions in your environment, like what vulnerabilities exist in the system, in the application, in my process, or the human element? What types of threats exist that could be exploited from those vulnerabilities? And what probability does each potential exploit or vulnerability carry? So remember that a vulnerability is a flaw in a component, a procedure, maybe your design or implementation. It could also be an internal control. So you may have put something into place that is now introducing new potential vulnerabilities that was supposed to fix other things, and maybe it did. But keeping that in mind. A threat actor here would be the potential for a person, a group, or even a thing to trigger that vulnerability. And then the risk is the probability that a particular threat will exercise that particular vulnerability and have some potential negative impact to you, whether that be a low impact or high impact, a high risk. Those things need to be considered. So determining your risk level. What I love about determining your risk levels is it kind of helps you create a roadmap. It helps you create a prioritization of what things you need to fix. So if you find that maybe you have some very serious vulnerabilities within your firewall, or your network administrators haven't properly set up ingress and egress. Maybe you haven't properly encrypted data, so your key management process isn't set up. It could also be something really simple as we have a lack of security culture within our organization. And don't go too far. We're going to talk about that one in just a minute. Now, once you've identified the risks, threats, and vulnerabilities, you want to make sure that you do not delay on risk mitigation, or at least creating a plan for risk mitigation. So remembering that vulnerabilities and risks, they're not going to go away. They will exist in your environment. So you need to make sure that those low-hanging fruit, the low-hanging vulnerabilities, the things that are simpler or easy to do, get those things knocked out of the park, fix them, get a plan for it. And there will be some projects or some vulnerabilities that are discovered, potential vulnerabilities that are discovered, that require more time and more resources to address. So again, the sooner you start doing that, the better it'll be for your organization in protecting data. If you haven't done this one, this could be a potential, a large potential of data fines for your organization as a result of neglecting that. Fourth, and training, and I won't spend too much time here because I talk about training till I'm blue in the face, but we need to make sure your staff are trained properly. And I've said that before, but remember that training your staff just at hire is not sufficient. That's not sufficient just for compliance, but especially for security. Your staff can be your greatest asset, or they can be your greatest liability. My recommendation is to hold at least monthly trainings for all of your staff. Train them on small, exciting bits of the security rule. Get them excited about it, what they can do to assist in securing your organization and patient data. Privacy rule and the breach notification rule. Trainings don't have to be too cumbersome. They really don't. So you might train on things like what are acceptable uses and disclosures of PHI. As I mentioned before, phishing or social engineering, how to properly physically secure our systems and data, locking doors and making sure that monitoring systems are turned on and available. These things will be important for your organization. Make it fun. If not, the patients, the recidivism rate will be pretty high for us, and that will not be a positive thing. So as we look at that, one thing I recommend is, now that you've trained your staff, if you have trained your staff, that you test your staff, so that you don't just leave it to, okay, I told you, I have it documented, it's in an email, or we had you go through some videos and check box them. You should be testing them. Do they understand what they read? Can they repeat it back to you? So it could be a discussion based. You might even have them perform a written test that says, hey, look, it's a quiz, if you will. And I know nobody loves quizzes, but it is a great way for you to engage and find out, was it effective? Will your staff be able to do the things that you've asked them to do? Or you could even do, in some fun ones, or some real life simulations. So you might send out and engage somebody to do a phishing attempt on your staff and see how many actually click on that and open you up to it after they've been trained. Fifth, everything else. So all the things. Let's talk about those. Now, as we look at bulking up your security and protecting your data, we sat down, we talked with our computer forensics team and asked what were the top ways that attackers are breaking into and compromising systems. And as we discussed before, it can be the human element, it can be through insecure remote access. There are a lot of different ways, but there's other security considerations that I recommend you consider. Are you logging your systems? Do you have your intrusion detection turned on? Intrusion prevention? Do you even have that capability? What about things like file integrity monitoring? As we look at our wireless network security, web application security, penetration testing, have you ever even done one of those? Whether that be an internal or an external application or network scan, segmentation checks. Again, there are so many things that need to be done to create this defense in depth to stop an attacker dead in their tracks. But how do we create a security, a rich and ubiquitous security culture in your organization? The tips are going to be paramount for you guys. You've got to make sure that we understand security does not come from the bottom up. It doesn't, and it can't. It doesn't work that way. Security needs to be a top-down approach. If it's not a top-down approach, it can be very frustrating for your staff members to try to help you to get it. And we'll oftentimes find that employees will leave an organization that doesn't seem to care about security. Because again, people in healthcare really do care about those patients. They may not always be the easiest to work with, but we care about them. We want their health and their safety to be first. That includes securing their data. So nothing else matters if you don't have a security culture. The reason I say that is I've worked with a lot of organizations that don't have a security culture, but are putting in a lot of time and effort, even money, into some controls. And what I find is that's kind of like putting a Band-Aid on a gunshot wound. It really just doesn't work. It's trying to patch up things, but we really haven't fixed us. We haven't fixed our cultural problem, and that's just that we're trying to get business done first rather than security. Security does not have to be overly challenging. It can be done easily. Well, easier. I shouldn't say security is ever really easy, otherwise it's no longer security, but you get the idea there. If you focus only on your compliance efforts, if you're checking just boxes and that's all that you do, you will find that you probably aren't going to be in compliance. I find that often, and you certainly won't be secure if that's all you're doing. So make sure you focus on both. What I've found is those that focus on their security, they focus on security first, securing systems and securing them properly, kind of just naturally flow into a compliance posture. So that's not a bad method of doing it. Now, don't ignore your compliance and only do security. Both need to be done, but build that security culture. Remember to get your C-suite, to get the executives aware and excited about it. You as the compliance officer, you as the privacy officer at your organization need to be promoting that. Need to be making sure that they are aware of the security threats, risks, and vulnerabilities in your organization. And they should be the ones that promote that culture. If they're not aware of the risks, threats, and vulnerabilities, most of the time, I find that executives will buy into marketing goodness. And we love those. We love our products, and we use some really awesome ones in our organizations. But those products oftentimes will say, they go to a conference and they see secure, they see compliant, they see best in industry. And those things oftentimes can be true if they're used properly. But we have to remember, some of those vulnerabilities were configuration problems. So, we didn't configure our systems properly. We introduced a human using the tool, who doesn't matter how awesome your tool is, if the human isn't trained in doing an awesome job, the system can't do its job. So your C-suite needs to understand that. Performing that risk assessment, putting that risk assessment in front of them, can be a powerful motivator to getting them excited. Now, the security culture really should combine your IT, your compliance, and your risk officers. I oftentimes find organizations that I come into, that the compliance officers are really excited, and they're doing a great job, and they're working their tails off to make sure everything's set up, done properly. But IT has done something that they needed to do for the organization that completely bypasses compliance, completely bypasses your security needs. So everybody needs to be on board, and they need to have the authority to implement changes as is needed. So that you identify something in your risk analysis, they need to have that authority to do it. We need to make sure that we have more budget and more emphasis put into security, remembering that your data and your patients are paramount. Keeping those things safe, keeping your system safe, will make sure that those patients have a good experience, that your organization will thus have a good experience. We want to protect both. And reminding your staff to follow what they learned in their security training. Boy, I would just talk about that all day if I could. We want to make sure that we create an environment, and I love to go and do assessments in environments where people are excited and they're not afraid to report suspicious behavior. And it doesn't necessarily just have to be suspicious behavior. It could just be to report a problem and say, hey, I noticed that we don't use two-factor authentication. Should we be using it? They shouldn't be afraid to bring that up. They might say, hey, when I do this thing, whatever that thing may be, this other negative impact is happening. We want to empower them to bring up security issues. A great company culture, a great security culture will facilitate that, will rise them up and empower them. So I encourage you to do it. So let's talk briefly about some of the takeaways from today's discussion. The reality is, we're only here for just a brief, less than an hour really, to talk about compliance and security. Compliance and security is a year-long continual process. It's not a one point in time. Now, if you have somebody like me come out and visit you when I perform a security assessment on your organization, whether that be for PCI or HIPAA or GDPR, SOC, oftentimes those things are point in time. They state the position, the compliance and the security of your organization at a single point, at a single time. Some requirements are making it so that we can show or demonstrate that we've been doing more, at least a quarterly basis, whether that be through scanning, whether it be through segmentation checks, policy reviews. But you sitting there, wherever you are today, need to make sure that your processes are in place to make this an ongoing, a daily thing, and that your staff remember that. Because again, they're running around trying to do their duty, their job, help the patient, and it can happen really quickly that they make a mistake, that the tool isn't configured and leads to a breach of data. So let's make sure that all of your policies and procedures are in place, that they are documented, and that everybody is aware of them. If you're missing policies and procedures, whether they be in HIPAA or any other security mandate, you need to make sure that you get those. You can purchase a lot of policies and procedures from vendors that can help you with that, so that you're not reinventing the wheel, if you will. But it has to be done, and it can't be ignored. It will be cumbersome at first, but it shouldn't be that bad as you move forward in those policies and procedures. Engaging somebody like a security assessor can help you with that. You need to be prepared for a data breach, recognizing that a load of people within the healthcare profession are being breached today. Patient information is being lost at a staggering rate, a very staggering rate. So if you're not prepared for it, it'll be a bad experience for you and your organization. So get that incident response plan prepared. Make sure that your security is as best as you can get it, and then we are ready for that. Conduct a risk analysis, an annual risk analysis, and a risk analysis after any significant change to your organization, to process. Something to give an example there might be some of your environment is in a physical space. So you have your servers on premises. So your servers are on premises, your firewalls. But you know what? You've now found maybe somebody like Amazon or Armor or something like that. And you say, you know what? We're going to move some of this. We're going to save some money on infrastructure, and we're going to move that to those guys and let them take care of it. And I applaud your efforts. Whatever you can make easier for yourselves is awesome. That should be done. However, you need to make sure that you understand the risks, threats, and vulnerabilities that are now going to be introduced into your environment, to your processes, to your people, to your data. That those things they just inherently will do. So make sure a risk analysis is done. I get very excited about that because it's one of the funnest things you can do. You will really, I think you'll have a good time when you've done it and feel a little better knowing what those vulnerabilities were so you can create an action plan. You might not feel so good when you see the vulnerabilities, but at least you can create an action plan for them. Remember to train and test your employees regularly. You don't have to go that alone. There are a load of people that can help you do that. There's online tools and things that will help with things like phishing. Those can be a lot of fun to show your employees, look, these were the types of phishing attacks that we trained you on and you just didn't follow. Their brain just kind of gave up for a few minutes and they clicked on a link somewhere. Okay, well then we can retrain them and make sure that they get excited. Bulk up your security practices. Remember, some of these things that we talked about only 5. There are hundreds of security tools and processes that need to be put into place. That can be an overwhelming statement in and of itself, but you don't have to do that alone either. You can make sure that you bring in your team, get everybody else on board and excited. And if you have to engage a third party to help you with it, please do. People want to make sure, and there's some really awesome tools and processes out there that can make your processes better. You might just not be aware of them today. And as I do every moment of the day, remember that your patients are important. Your organization's important. So when you live and breathe security, that process, again, won't be just a point in time. It'll be an every moment of the day. You're here. You've engaged in this webinar to make sure that your data is secure, that you're compliant. And these are just a few points, but make sure this is done. Now, I know I have talked about a lot of things. There's a lot of things that I haven't talked about. What I want to do is make sure that you guys are able to ask any questions that you have. So what we're going to do is hit pause real quick. We're going to read through some of these questions and we'll get some of your questions answered. Give me just one moment, guys, and we'll get to your questions. All right, guys, thanks so much for engaging and asking some questions. We got some great ones here. So for those of you that missed the beginning of the webinar, we will be sending out a recorded copy of this webinar so that you can cover all of the details and including sharing it with anybody in your organization that needs to be trained on best security practices and HIPAA compliance. Now, one of the great questions, I'm super glad you asked it, is can I give a breakdown, or can we give a breakdown of the difference between an internal and an external breach? Now, that's one that we see quite frequently. So when we're talking about an internal breach, it's easy to think of the organization as everybody needs access. I guess maybe that's probably one of the best things to say, is that everybody believes that everybody should have the same access. And that is almost never true. So we need to be thinking about types of role-based access control. So again, back to that example that I gave earlier of the front desk office personnel. They're not going to need the same access or level of access that we see a developer needs, or a network administrator or systems administrator. So their access is going to be different. And it's in HIPAA, we typically hear the word minimum necessary. So only giving those people access between what's necessary. Now, once an attacker, if it's an attacker that causes the breach, or it was a staff member with access to shares or drives, or access to people's folders they shouldn't have had, that would certainly constitute an internal breach. But we oftentimes see an attacker who gets internal to the network, so who gets internal to your organization. They've got some very escalated privileges that they're able to act upon or to exploit. That once an attacker has got to that point, that's why that would be a really bad thing. But that's why we talk about this defense in depth. So things like logging, file integrity monitoring, intrusion detection, intrusion prevention. Because again, oftentimes people will say, okay, well, I've got my external control set up, my perimeter set up. That'll be my firewall. That protects against what type of ingress, so inbound, and egress is set up outbound. But yes, the internal and external breach is something that we see oftentimes. Most of the time, the breaches that get publicized is an external. So external to our organization, somebody who might be sitting in China or in Russia. You would never see, you would never know, probably never going to be caught, and is breaching your network. And those network scans are taking place all the time. If your network is publicly available, meaning connected to the internet, and somebody can obtain an IP address or a URL, they are scanning your system. It is happening all the time. So make sure we harden against both. And a security assessor, somebody like myself, would come in and look at the risks, threats, and vulnerabilities, both internal to your organization and external. It is quite common that we talk about the attacker, right? But that's not the only risk, threat, and vulnerability. Some things will be environmental. Some things may be regulatory or legal. So all of those things have to be kept into. But I love that question. It's a phenomenal thing to be thinking about, and you're the first person to ask me that in a long time. So I'm giving you an air high five from here. Good job.
And Brand, we have another great question here for you. And then we'll get into our PyScan demo. But you mentioned file integrity monitoring. Do you have any examples of what that means?
Absolutely. So file integrity monitoring can really be a very long discussion. But to make it simple, or at a very high level, file integrity monitoring is a tool that is used to monitor sensitive files within your organization. So you're going to have files that are stored within your database, or flat files, things that may be system related, so that it may not necessarily store data or have data that's being transmitted, but that are critical system files. And if those files are changed, so somebody or something that doesn't have permission, or well, unfortunately does get permission and gets a hold of those files, and they change, whether it be they change the integrity of it. So you see a file that maybe is a couple hundred, oh boy, a heavy one, let's say at a couple hundred megabytes, and it increases in size to a couple hundred gigabytes, or just a few gigabytes. That would be a pretty wild change in the integrity of that file, and you need to be alerted of the presence of that. You need to know that could be a potential malware that you have in your system, rootkit, all kinds of things that can cause all kinds of problems for you. But it could also be somebody who's inappropriately accessing a file that they shouldn't have. So every file or every system is going to have permissions that allows for somebody to connect to it and see it. And if anybody either inadvertently or intentionally accesses those, you will be alerted to that presence. So at a nutshell, file integrity monitoring is there. File integrity monitoring is really an awesome supplement to your antivirus systems. So a lot of people may get them confused, and they have some similarities, some baselines that are similar, but file integrity monitoring is a great supplement. And there's some awesome tools out there. In the reality, you guys might already have these tools purchased. I come into organizations all the time where these tools are already being used, but they just didn't turn it on. So make sure you query with your IT professionals, what tools do we have and what subscriptions do we have that we just don't use? file integrity monitoring, intrusion detection, intrusion prevention. These are very common. They're there. You just didn't use them. You just need to turn them on, turn the switch on. Great question.
Awesome. Well, thanks, Brand, and thanks everyone for joining us for today's webinar. We're actually going to go ahead and begin with our PyScan demo now. And I'm going to go ahead and turn the time over to Kai Whitaker, who is our PyScan product manager. So for those of you that would like to stick around, we're going to jump in. It's just going to be a quick 4 to 5 minute demo so you can learn about how PyScan can benefit your organization.
Great. Thanks, Andrew. My name is Kai Whitaker. I'm the product manager for our data discovery tools, of which today we're going to talk about PyScan. The PII in PyScan stands for Personally Identifiable Information. And what this means is this is any kind of data that you collect from a patient or a customer that can then be used to identify that customer. So anywhere from an email address, a phone number, to a credit card number or a social security number. And so at Security Metrics, we're trying to make your data security easier. So a lot of requirements such as HIPAA and PCI and GDPR are going to tell you, hey, you need to make sure your data is secure. Well, that's a really large undertaking, and a lot of people don't even know where to start. One of the first steps that you should do is, well, if I need to protect my data, I need to find out where my data is. So on my network, on my computers, within my organization, where are all the places that my customer and patient information is being stored? Is it on computers? Is it on servers? Is it up in the cloud somewhere? So what we've done is we've created a tool that will actually scan your computer. It will scan your server. It will scan your endpoints. And search for this personally identifiable information for you. So instead of having to manually click through every file on your computer and read every document to make sure that there isn't some random Excel spreadsheet out there that was saved from 3 years ago that is a list of email addresses that is just unprotected and waiting to be stolen by a hacker or someone attacking your system, you can identify that first, figure out where it is, and then adjust it, and adjust your processes so that it doesn't end up there, or so that it is protected. So what PyScan does, and I'll talk along as we kind of have this descriptive video going on. PyScan is a data discovery tool, and it's going to scan these endpoints and locate this unprotected Pi for you. So we make it really simple. It's got an easy interface, installs really simply, and it's going to let you scan your computer right away. Once your scan is completed, you can review your results in the application itself and be taken directly to the Pi in question. So as we do have advanced settings, so people who have networks who are slightly different, you can configure your scan to do what you need it to do. We do use patented scan technology, so it's optimized to reduce false positives. We give you filters so you can reduce the scope of your scan and increase the reliability of your results. So really, you use this to discover the data, reduce your liability, and protect yourself in the event of a hacker. So for example, if I am a single location dentist office and I have 4 computers in my office, I would be able to use PyScan to quickly scan each of those computers and then identify if, on this computer, this shouldn't be touching any credit card or patient information at all, but we did find some on there. Then I can reach out to a qualified professional or my IT guy and say, why is this here? We need to stop this data from being there. Let's remove it and then adjust our process. And that can be a single location. It also works for, a larger organization where, hey, I've got, multiple networks and subnets, and I've got a lot of servers, and this one is segmented here and there, and we can place PyScan in these separate locations to really facilitate your IT team and help them save a lot of time and a lot of effort in finding this information, because we're going to do it for you. So That's a quick overview of our PyScan product. If you have any questions about PyScan and how that can fit in your organization, please reach out to us. We'd love to have a more in-depth conversation about it. Thanks.
Awesome. Well, thanks, Kai, and thank you to Brand for presenting today. Again, if you have any questions, feel free to reach out to us. You can connect with us by emailing events@securitymetrics.com. And we do have a couple other questions that we weren't able to get to today, so we'll make sure to reach out to you on an individual basis so you can get that answered. But thanks everyone for joining us today, and we'll talk to you again soon. Thanks.